Hello, my name is Andreea and I will present you my research project, which is focused on assessing the impact of a prior pregnancy loss on depressive symptoms in subsequent pregnancies for a sample of Romanian pregnant women. I have chosen to talk about this topic as prior research shows that 12 up to 20% of all known pregnancies result in pregnancy losses. Of the many women who experience such a loss, between 50 and 80% become pregnant again. This is important as the parental response to such an experience can impact the subsequent pregnancy, often resulting in difficulties adjusting to the new pregnancy. More so, to our knowledge, there are no studies that focus on assessing the impact of the implications of pregnancy loss on women who have a subsequent pregnancy, and there is no available data on the prevalence of perinatal depression, with most of the studies focusing on antenatal depression. So we hypothesized that pregnant women following a miscarriage would be at an increased risk of occurrence of depressive symptoms compared with women who have their first pregnancy or have not had previous pregnancy loss. We completed a secondary data analysis of the Advancing Maternal and Child Health project in Romania, which was a cohort study that aimed to explore and explain psychosocial stress and its association with pregnancy outcome in Romania. We used descriptive statistics to describe the study participants and logistic regression analysis to examine the factors associated with the symptoms of depression. We used a standardized scale, EPDS, which to assess the depressive symptoms in the sample of pregnant women. This scale was validated in Romania by a team of researchers from here. As you can see in this table, the final sample size for the analysis consisted of 1,958 women. Most of the women in the sample were nulliparous, followed by women who have had a live birth and women who have had a miscarriage or other unintentional pregnancy loss. Demographics showed that women were mainly living in an urban area with a mean age of 20 years old, ranging from 80 to 44 years old. The prevalence of depression symptoms in the total sample was of 24%. As you can see, the prevalence of depression symptoms in subsamples was the highest in women with a miscarriage or other unintentional pregnancy loss, followed by women with a live birth and women with no previous pregnancy. Regression analysis showed that women who have had a prior miscarriage were 2.5 times more likely to have depression symptoms compared to women without prior pregnancy loss. This relation was statistically significant even after controlling for age, place of residence, income, occupation, education, and pregnancy intention. These results were consistent among all pregnancy groups, with women who have had a miscarriage being 1.72 times more likely to have depression symptoms compared with women who have had a prior live birth, and 2.23 times more likely to have depression symptoms when compared with women who had no previous pregnancy. Therefore, our study was consistent with our hypothesis and also with other studies that have focused on this issue, and found that the history of miscarriage was associated with a significantly increased risk of symptoms of depression. One of the limitations of our study was that, being a secondary data analysis, we did not have data collected on contextual information related to the circumstances of pregnancy loss. We consider that implications for future studies should involve an understanding of the needs of women who have gone through a previous pregnancy loss, which might help professionals in delivering effective care. Also, findings from this study stress the importance of designing interventions to reduce psychological distress for women who have gone through such a loss as they enter subsequent pregnancies.